We're going to now move on to our first panel discussion of the week. So I'm going to bring up Vernon Silva. I'd like to welcome Vernon. Vernon will be moderating a patient panel on the topic Overcoming the Fear of a Kidney Failure Diagnosis and Getting the Treatment You Need. Vernon is a licensed clinical social worker based out of Bishop, California, who has served the kidney community for 22 years and is the brother of a kidney patient who is his guardian angel. Vernon has held a national certification in nephrology social work, conducts professional trainings and conference presentations, and performs volunteer work for kidney organizations. He's also authored quite a few pieces of the Renal Support Network's newsletter, Kidney Talk, the National Kidney Foundation's newsletter, Renal Link, and the Kidney Care Industry magazine, Nephrology News and Issues. With that, I will go ahead and pass it on to you, Vernon. Thank you for being here.
Okay. Well, thank you, everybody, for attending this afternoon and this evening. It's such a pleasure to be here. I also, would like to thank Renal Support Network, Lori Hartwell, and all of the wonderful staff there who serve us so well, and I so admire and appreciate. I'd also like to thank the panelist that will be joining us, Janelle Kent, and I will allow her to introduce herself once we get started. The way that we're going to be formatting today's session is I will start off by giving out a little bit of information regarding what we're speaking about today, and then I'd like to interview Janelle to provide the patient perspective. Okay. Today, what we are here, Janelle and myself, are to do here is to convey to you how fear can permeate our renal replacement therapy experiences, and also ideas of how to work through fear and hopefully how to overcome it. Now, the word fear itself can elicit fear, can't it? And it's a very loaded word, but I'm sure all of us have experienced it to some extent, whether highly intense or maybe in passing, but it is just a common human emotion and reaction. Other words that we can use instead of fear that you might want to substitute for that now as we go forward in our talk today is say phobia, anxiety, scared, afraid, hesitant, apprehensive, and perhaps overwhelmed. Okay. Have any of you ever felt any of those? That's what we're going to be talking about. We're just going to put it all under the word fear. And I'm sorry that that's so strong. Let's go ahead and get the official definition for fear. Noun, an unpleasant emotion caused by the belief that something is dangerous or likely to cause pain or a threat. Okay. Verb, to be afraid of something that's maybe likely to be dangerous, painful, or threatening. Now, fear, like all other emotions out there, and some of them that we associate with something negative, like let's say depression, anxiety, or anger, actually has utility. There's a reason why we all can experience fear, phobias, anxiety, being afraid or scared, hesitant, apprehensive, and overwhelmed. It has utility. What it does is it helps us to learn to manage or regulate our emotions. And this is all about emotions, okay? So that its true purpose for existing in our emotional field is maintained. Fear keeps us alert. It keeps us engaged, and it may even keep us proactive. Fear may help us to plan, everybody, okay, to build effective coping mechanisms and skills towards our stressors, okay? Understanding the mechanisms behind our brain's own responses to keep us feeling safe in tentative situations. It helps us be aware and regulate or control our emotions in an appropriate and healthy way. So I just wanted to normalize what fear is and help you to relate to it as our topic for today. I have a few questions to start off with. for Janelle. Janelle, before we get started on the questions, could you please introduce yourself and give us your bio?
I'll do a short version. Hi, everybody. I'm Janelle, and thank you so much for the invitation. Yeah, I think these are powerful things to talk about. So my bio, so I'll start off. I'm 66 now, and I worked full time for Inyo County for about 22 years. Both in substance abuse counseling and mental health counseling. And my journey with kidney disease really started from birth, but I wasn't formally diagnosed until age 11, where they found that I had reflux, basically, pretty much my whole early life, and I had corrective surgery on my ureter tubes, so that solved that problem. Unfortunately, I had another plumbing issue, and that was with my large intestine, which took many years to figure out, and I had about a foot of that resectioned when I was 13, and presto changeo, I was like a healthy kid. I spent a lot of years with episodes of illness. Otherwise, I was a very energetic, normal kid when those episodes weren't occurring. But anyway, so through that, my pediatrician at the time got me connected to a urologist, a specialist, a pediatric urologist. And then when I think I was 18 or 19, I started with a nephrologist formally as an adult. And I had that doctor for 40 years. And he was fantastic. Of course, I had other nephrologists in and out with dialysis, but he was my main guy. And very grateful for him. Anyway, so I had kidney failure about the age of 23. Before that, like I said, I kind of got healthy. I grew a bit more. I was pretty petite, and I have a large family, tall, and so I was the small kid for a lot. But when I was in high school, I played sports, and that was just like so powerful to me, and really is why I like school so much, to be honest. And I stayed a runner for many years, even through dialysis, and up until probably in my very early 40s. But I've always been very active. In Bishop, I still hike, although I'm not near what I was a few years ago, which, is partially due to aging. But noticing I don't have the energy level I used to have. And I think the balance and the agility, which I think just changes over time anyway. But I've taken very good care of myself, kind of knowing what my fate would be. And fear is a funny word for me because I know we're talking about fear. I think because my history has been so long, and I just feel like I've had so much trust in my doctors and the people in dialysis and being able to take care of me and knowing that I could take care of myself. I'm pretty self-sufficient. I'm an independent person. I'm not married, or nor am I in a relationship at this point, which has actually been good for me. So I think as far as that bio goes, I've been through all modalities. My mother gave me my first transplant a year. I spent the first year on chemo. I had a transplant for 3.5 years that my mother gave me. And then I went on to peritoneal dialysis. And I appreciated the freedom of that, allowed me to work. And of course, in those early years, I was doing every kind of job under the sun. I wasn't a professional until much later in my life. I had a second transplant, which was didn't work, lasted 7 days in the hospital, went back on peritoneal, and did that again until I had my last transplant, which lasted 22 years. And that was a cadaver. And it was awesome, all things considered. You know, there are things to consider for all modalities. None of them are perfect, and they all have their challenges. But transplant really is, you know, a pretty awesome deal if you can get there. Right now, I'm back on hemo. It's been actually just 2 years. That came about because I had kind of a double whammy peritonitis that I got very toxic, and living in Bishop, we're very, very rural. And so I was flown out to San Jose to a hospital, and they took good care of me, but I was there for 2 months and then 3 weeks of rehab. And I don't know, fear in the sense that Vernon was first talking about, but I think some anxiety because I really wasn't myself after that whole incident, and I'm glad to kind of be back to myself. But that produced a little anxiety for sure. But I have great support friends, and they took care of my house and my animals and did everything I could imagine and more. And I'm really okay being back on hemo. I was on peritoneal this last time, starting 2015, for 6.5 years. And so that worked very well. And I was able to work full time and, you know, take care of things that way. So I feel very fortunate. I don't have a lot of other issues health-wise. I do have some calcification in some valves now in my heart, but they seem to kind of just have been stabilized right now. So we'll check in on that. Other than that, my dialysis days, I'm usually will be waking up from a nap about now, but I feel pretty good today. So I always try and get a nap in, and I feel much better afterwards. And I pretty much do whatever I want.
Well, let's tap into your expertise. Thank you so very much. That was beautifully articulated, Janelle.
Thanks.
Ready? As
Yeah.
a social worker, as I was introduced, I wanted to tell you that many in-center dialysis patients tell me that they are not interested in choosing a home modality, you know, like peritoneal dialysis or home hemo, because they're afraid of that. They are afraid, there's our word, something might go wrong during the treatment, and there's no medical staff there to make the correction or help stabilize the problem.
Right.
Can you please speak to that fear?
Yeah, I just put a couple bullet points so I wouldn't forget. Number one, it's not for everyone. The modality itself is not difficult. The fear that people might have, to me, is unwarranted. Number one, you get excellent training. My training was three weeks, 5 days a week. And so that person, that the preceptor, whoever that is training you, knows their stuff. And they can be a technician, and they can also be an RN or an LVN, I guess. I'm not really sure about that. But so you get excellent training. You also, so I did the cycler, if you are familiar with that. So I would come home from work by 7 o'clock. I'd hook myself up, set my machine up, hook myself up, and be done with it and go to bed, whenever I decided. Just was important to get on at the right time so I could, get up and get myself going to get ready for work. So you also have 24/7 support for nurses on call, right? So you're given all this information in your training, and you have access to that. You also have technical support for your machine if something were to happen. I think that, so with that, I felt comfortable. And of course, I had already done it in the past, and it really hadn't changed a lot. The machines were a little different, but basically, the technology has been the same since the 80s, as far as I'm aware. Staff is very thorough and they're very patient. There's no dumb questions. And it just depends on the kind of person you are. If you are a very independent person like I am, that worked well for me for quite a long time. It's a lot. I mean, it's a lot of work right there, right? You have to have space for all the monthly supplies that you get, and you get everything you need. And there's that support too if something's not right. So scheduling is a big deal. And getting used to, number one, having that fluid, the dialysate in your body, that's an adjustment. I never had any fear about it, but it's uncomfortable in the beginning, and then you get used to it. Also, sleeping, you might have to make some adjustments sleeping. And the machine has alarms. So like say you kinked a line or something by the way you're sleeping, or something's going on, the machine's going to tell you. And there's also a booklet that you can refer to if you had any issues or any questions that way. Let's see, I'm not thought about doing home hemo because I think that's probably better served with a partner that can help you. So I haven't really considered that. And I don't have any qualms about hemo. I used to make a fuss about it when I was younger. But it's been a godsend. I'm so fortunate to have a dialysis unit where I live, because that's, a town this size is probably mostly unheard of. Is that
Yes,
given up?
wonderful. Thank you. Are you
Yeah.
ready for our second question now?
Sure, go for it.
Many renal patients express to me significant hesitation accepting kidney donation offers from family members or exploring family members considering to be a donor. There is fear that something will go wrong with that family member because of the donation, and that the patient will then feel responsible for it. And fear of being turned down and disappointed if a family member is asked to donate, or placing them in an awkward situation. Anxiety that accompanies these awkward conversations. Can you please speak to that?
Yeah, I think this is probably the hardest one for me, being a very self-sufficient person. Maybe to the degree I'm a little better now, so that's good. But I think, these are anxiety producing. If somebody offers, my goodness, grab it by the horns. There's a whole process that people go through to, number one, blood type, and to see if you are a good match or not. So it's very thorough. And, that's a real blessing if you have somebody who is willing and able. And, even today, right, there's the chain kind of networks that happen at through certain hospitals, maybe all hospitals now, where if somebody wants to offer a kidney to you and they're in good health and they want to do that and everything goes through, then they may give that kidney to someone else that's in need, and then you get one that meets the criteria for you. It's a lot to ask of someone. My mother was, jumped at the chance, and she was a good candidate on lots of levels. But she was also 55, and she had been a smoker and had 5 kids. So, but I had 3.5 years, and of course, eternally grateful. I mean, it's the gift of life, right? As far as, it's such a personal decision. And if you have discussions with your family, if they know what's going on in your world as far as your illness, they can get educated, right? I mean, you can meet with transplant team. They're going to give you kind of the whole rundown of everything. My mother did very well after her transplant, other than, she was taking longer to recover than I did as far as surgery goes, because it's a big surgery. And, but as far as her health, she had no ill effects. And my understanding, and I could have this somewhat wrong, but I remember hearing that, we're born with more kidneys than we need for most people in life, right? We're given some extra there. So as far as that other person having bad side effects, I'm sure there's some out there, but I haven't ever come across it. And I think people really want to help, right? They want to do for you what, is best for you. And if people aren't on board with that, like I said, it's a very personal decision, and there could be lots of different reasons why. And I think just accept that and thank them for, acknowledge them for listening. And you just never know. You never know. So, and you may not have, oddly as it sounds, family members that don't meet criteria, right? So, and that's the case for me. I have 2 half siblings, and so they weren't good. Well, actually, my sister half sibling only had 1 kidney, which she found out when she was pregnant. So that was odd. And then my youngest brother, who's very healthy, his daughter, who's in her mid-20s now, has lupus, and I told him he needed to be ready if she needed a kidney. So.
Thank you.
Yeah.
Janelle, transplant patients may feel fear of rejection of the transplanted kidney. How have you handled that in your life?
Well, I think I've accepted that for a long time, and that potential is there. But, we have a lot of power in how we take care of ourselves. I ultimately believe, yes, we have doctors and nurses and people that care for us and guide us, but ultimately it's our responsibility a lot. And I think just coming to that realization is important to allay fear. I mean, you can do what you can do to the best of your ability, right? You listen to the doctors and the nurses because they're way more educated than I am. And you follow those instructions. Just like dialysis. If at all possible, you don't miss treatments. And the same way with transplant, you take your meds. Mm-hmm. And that's not always the fun part because there are side effects to those things. But with any of the modalities, there are side effects. And so I never have really had anxiety about that. Like when I went back, when my 22-year kidney started to decline, and we really watched that through, my creatinine started to jump up. And so I really made the proactive decision myself that, I don't want to get sick. I wasn't feeling sick then, but I didn't want to. I didn't want to even, that would create more anxiety for me. So in 2015, made that decision. And yes, with my doctor, but ultimately it was my decision. So I think being responsible for your health and well-being is super important. And I think other people's fears can get in the way sometimes. And so I think in my life, somehow I learned to manage that by being okay most of the time. And that might not have always been true. But I think sometimes we try and protect the people that are seeing us go through things that are uncomfortable or scary or unfamiliar. And I just think I have such a long history that I don't really recognize the fear factor. I mean, there's definitely things to be fearful for in the world, but I think you just do what you can do to the best of your ability. You follow treatment recommendations, and that's where I go.
You just do what you can do. I love that, and that'll always live with me.
Mm-hmm.
Our last two questions, I'm going to combine into one.
Sure.
You have in the past been treated with in-center hemodialysis, and you are now, after all this journey, and you embrace it. So I know that there's other people who are attending and on this call who may be experiencing hemodialysis as well at any stage of their life, whether they're brand new to it or not. So I want to ask you a question about cannulation, please.
Yeah.
All right. Some patients express a fear of traveling because a person who is not familiar with their access will be cannulating. And then I want to add on to that, needle phobia, here's our phobia, comes in many different intensities. How do you deal with fear of needles? Or I guess also adding on a fear of somebody who's unfamiliar with your access.
Yeah. I've never had a fear of needles, and I'm sure that goes back to childhood. I mean, from the get-go. Don't particularly care for it. I mean, but in the day, and some people might remember this, and certainly providers of services, is that they used to stick you with lidocaine. That was painful. It stung like the dickens. And that was just standard procedure many years ago. I don't know when they changed that, but when I came to do this, I didn't even think about it. And to be very honest, I barely feel anybody sticking me. Techs are well trained, and they're sensitive people that work in dialysis. They develop relationships with people. So it's kind of different than a lot of, like hospital nursing or CNAs, or right. You get a connection with the people that take care of you. And I think they're very sensitive to hurting at all. And I can't say that I've ever been infiltrated. I do have a graft, so I think that is oftentimes easier for technicians. But I mean, I've been infiltrated, getting blood drawn from a phlebotomist. I've been infiltrated, in the hospital. I guess it's part of the risk. But I don't have any problem with getting stuck. I don't know. It's just been a breeze. I don't know what to say.
Well,
So I don't have
Mhm.
fear that way.
Mhm. Well, all of your responsives have been so genuine, and I really admire and I appreciate that. And
Yeah.
I'm very inspired by your story too, and your wisdom and your knowledge. And I just wanted to thank you publicly in front of everybody.
Thank you, Vernon.
Absolutely. And I'd like to open up the forum to anybody who may have a question from the webinar chat or wants to chime in vocally. Are there any questions that you would like to ask our panel, Janelle Kent?
Hi, Vernon. So we do have one question in the chat, but I'll also give a few minutes to see if any more filter through. I think you might have addressed this already a bit, Janelle, but Jacqueline wants to know, do you do home dialysis?
No, I don't. My understanding is that, well, and I don't know if this is even true anymore, that usually I think they would like a partner to be your helper for that. I don't know if that's changed since a couple years back when I was talked to about it. I did explore it a little bit, but I don't know. I'm okay going to the unit. I like going there. I like seeing the people that I see. I, the other patients, and it's good, especially since I'm retired. It doesn't feel like a burden to me.
Well, thank you for that answer. Yeah, okay. It doesn't look like we have any other questions, so I just want to thank you, Vernon, for moderating such a great panel, and Janelle for being so candid and sharing your experiences with us. I think it's a great way to end our day 2 of Hope Week. So thank you both for taking the time to be here.
You're so welcome. My pleasure.
Absolutely. Thank you. And welcome everybody to the rest of the week as well.
And a shout out to our corporate mission partners for making this happen.